Saudi Arabia, Qatar, and United Arab Emirates. Before I do, I'll sign one of the most consequential executive orders in our country's history. I don't think there's ever been anything signed like this, certainly not with respect to health care, nothing even close. I'm delighted to be joined on this occasion by Secretary of Health and Human Services Robert F. Kennedy, Jr., who is doing a really good job, I have to tell you that. CMS Administrator, a friend of mine, Dr. Mehmet Oz, who is an amazing guy. You know, I was telling Bobby before, Oz had a very successful show, but it hurt his reputation. Because when you're in show business, it hurts your reputation a little bit. It's good for you, but in terms of professionalism and being a doctor, it sort of hurts your reputation. This guy went to the best schools, was the best, I mean, top of the line. Then he did a television show, became a success. Made a lot of money, all that stuff, but it sort of hurt him. And you know who I compare that to? I hate to say this, but a special woman, Jeanine Pirro. She was the toughest, smartest DA, maybe in our countries, in our cities and states, history, New York. She was really tough, really sharp. Then she did a show, and people didn't think of her quite the same way. She became more of an entertainment person, like Oz. Oz is not an entertainer. He's not really an entertainer, if you know the real story. And she isn't either. She is unbelievable. She was one of the strongest district attorneys in the history of New York. Highly respected, very tough. Went after the drug dealers at a level that you don't see today anymore. And hopefully she's given up a tremendous, she's leaving the #1 show on cable television, one of the #1 shows on television, period. The 5, but they've got great people left behind, but she was a big part of it. And so I equated to that. Jeanine Pirro is unbelievable. FDA Commissioner Dr. Marty McCary, with a reputation that's second to none, and the job he's doing already has been fantastic. Thank you, Marty. And Director of National Institute of Health, Jay Bhattacharya, who has been, as you know, from Stanford, so highly regarded, and have all been working with us very hard on this. And the question they would ask, being a little bit new to the government aspect of it, is why doesn't somebody fight the drug price situation, meaning equalization? There's a term, it's called equalization. Nobody wants to mention that term. And I'm not knocking the drug companies. I'm really more knocking the countries than the drug companies, because they're forced to do things. But the drug lobby is the strongest lobby in this country.